Refer patient for psychological evaluation by primary care provider, psychologist, psychiatrist, psychiatric RN, counselor, or social worker, particularly one trained in special needs of women with PPD. Reassure patient she's not alone and that what she's feeling is real. Encourage patient to ask for help with baby, housework, and meals. Teach patient how to maximize sleep. As a public health nurse, assess the baby in home and provide follow-up care as appropriate. Evaluation. The patient engages more in social activities. The patient can express her feelings and insecurities. The patient can perform her activities of daily living. And the patient recognizes the importance of counseling and regularly attends one. Strategies to be used for client with postpartum depression. PPD screening. It's important to ask the right question and keep asking them to help patients with PPD get appropriate treatment. Even if you have time to ask just 2 questions, ask the 2 recommended by the U.S. Preventive Service Task Force for primary care settings. First question, over the past 2 weeks, have you felt down, depressed, or hopeless? Question number 2. Over the past 2 weeks, have you had little interest or pleasure in doing things? If the patient says yes, explore further by asking, have you felt this way for several days, more than half the days, or nearly every day? Another widely used screening tool is the Edinburgh Postnatal Depression Scale, a 10-question tool that has been well-tested, validated, and translated into many languages. It can be completed by the patient in about 5 minutes. Offering a referral. If you suspect PPD, offering the patient a referral is the first step. Urge her to contact her primary care provider or refer her to a local psychiatrist, psychologist, psychiatric nurse, family therapist, or licensed clinical social worker. Keep in mind that many women with PPD are too overwhelmed, exhausted, or scared to make the first phone call without help. So be prepared to help them make the call if necessary. Know too that PPD support groups and national hotlines exist.